I'd like to welcome everyone to this bright and early morning session. The devil is in the details session, and the devil in the details sessions are focused on technical aspects of minimally invasive surgery. This session is going to be focusing on bariatric conversions from sleeve gastrectomy and conversions from lap band operations to other operations. And these are problems which, as bariatric surgeons, we face on an increasingly common basis. My name is Dr. Dan Herron. I'm a bariatric and general surgeon from Mount Sinai Hospital in New York, and I'm working with Marina Kurian, who's also a bariatric and general surgeon from New York University, also in New York. I would like to start by just reading a quick statement that SAGES, it's not a marketing agency. It doesn't endorse any specific companies or any specific surgical products, but in the course of running a course like this, we do mention a lot of different surgical devices. We're going to try and avoid the use of brand names and try and use generic names if possible. Please be sure to fill out your evaluation forms. That's the only way that we can make these courses better. If you do notice any bias from any of the speakers, please let us know so we can modify our talks in the future. We'd like to get started. Right. So if we can move forward, we're going to talk about the different ways. That's my disclosures. We're going to start with the first half of the session talking about the problematic sleeve. And sleeves are a deceptively simple operation. I mean, what could be simpler? You put a bougie in, you fire a stapler a few times, you make the stomach smaller, and yet you can have two patients who have similar anatomy, have had the same stapler and the same bougie and a similar upper GI postoperatively, and yet one may have a fantastic postoperative outcome and the other may not. So we're going to be discussing three different situations here. What happens if you have an intact sleeve but poor weight loss? What happens if you have a dilated or a problematic sleeve with poor weight loss? Or what happens if you have an intact sleeve and maybe even good weight loss, but the patient has significant side effects, whether they be GERD or GERD-like side effects or globus or unusual swallowing issues, which we see more and more commonly with sleeve gastrectomy.